Okay, implicit racial bias is non-conscious, which means outside of awareness, prejudice favoring majority. In the US, that's white people versus minority individuals. It includes verbal and nonverbal cues and behaviors that, while unconscious to the healthcare provider, are evident to the recipient. Examples of implicit racial bias are minorities are Medicare recipients, minorities are addicted to painkillers, minorities are uncooperative, Latinos don't speak English. Implicit racial bias manifests in greater provider use of socially dominant language, which are first-person plural pronouns like we or us, and anxiety that the interaction with the patient will be difficult. Implicit bias is highly prevalent in emergency medicine. Minorities experience longer waiting times than white patients. And this is a quote from a Latino man who said, "I was in the ER and a guy came in. He was a Caucasian, and I don't know what his medical problem was, but I know that he was in and out of there within an hour. Triage, doctors, everything. We are just sitting here, all the black people, Puerto Rican people, we are just looking at each other. Did you see that? It was unbelievable. Almost started a riot in there. This is Manhattan. Wow. That is all it takes, huh? I have got to bleach my skin then." So this is taken from an article that's in the list of articles published here. Our minorities are less likely to receive analgesic medication than white patients and are also less likely to receive more advanced diagnostic screening. Most studies reviewed employed the implicit association test to assess physician implicit bias, and this pairs racial ethnic characteristics with pleasant and unpleasant words. Pro-white bias results in faster responding to white characteristics or pictures with pleasant words than to non-white characteristics or pictures with pleasant words. Healthcare practitioners in these studies were multi-ethnic, not just white. They were also South and East Asian, Arab, Middle Eastern, or multiracial. Most studies employed clinical vignettes or scenarios instead of real outcomes to evaluate the effect of implicit bias on clinical decision making. There are mixed views about the validity of clinical vignettes in predicting actual behavior. So the question is there implicit racial bias in medicine? The findings of multiple studies and systemic research reviews indicate that there is pro-white implicit bias in medicine. Levels are the same as seen in the general population. In the US, there is strong anti-black patient bias. This anti-black bias is equal for adult and child patients. Other significant implicit biases studied include sex and gender, socioeconomic status, mental illness, physical disability, and substance use. Does it affect treatment? That's another question that we're asking. Results suggest that implicit bias does affect quality of patient care. Though it's highest when there's an intersection of patient characteristics, such as a low-income black woman, so you have an income, race, and sex intersection there. Substance using Latina woman with a comorbid mental illness, so substance use, ethnicity, sex, and mental illness. Implicit racial bias is especially prevalent in stressful situations like the emergency room or emergency department. The reason why is that physicians have less information about patients. Physicians are stressed and fatigued. This situation exacerbates implicit biases, leads to automatic processing. Physician burnout, which was also studied, exacerbates explicit bias more than implicit bias. So that's actually worse of the two. With respect to health disparities, research on its effects, implicit racial bias in medicine on health outcomes is equivocal. So there's no clear indication of an effect on health outcomes. Why? Well, for several reasons. Participant recruitment, those with greatest bias may refuse participation in bias studies. Experimental studies are difficult to, if impossible, in this area, so it's really difficult to make a cause and effect relation here. And there's a complicated relation involving many intermediate variables. For instance, implicit racial bias can affect treatment effectiveness by impacting the ability of patients to remember treatment instructions. Implicit racial bias can affect patient trust, which reduces treatment compliance. We can see this in this one model published by Zescott et al. Again, it's available in the references, where you can see the pathway at the top. Path A is the one that you'd expect to happen, so that implicit bias would affect judgments and decisions about healthcare, which would affect disparities. That is a mediation pathway in itself. However, what is more likely to happen is that there's this complicated mediation pathway that involves more than one intermediate variable, so that provider implicit bias would affect communication and trust with patients, and then that would affect patient engagement and adherence to treatment, which would affect disparities in health. Implicit racial bias also exists in other levels of medicine beyond treatment, including medical school admissions, resident selection, professional recruitment, hiring, faculty, and academic medicine. So here's an interesting study that I just want to highlight. It was at Ohio State University College of Medicine. So there was an admission study. There were 140 admission committee members assessed after the 2011-2012 admission cycle. Overall, there was significant anti-Black candidate implicit bias. It was highest among males and faculty committee members, lowest among women, moderate among medical student committee members. The following, this is notable, the following 2012-2013 cycle was the most diverse. Some in the study say that the IAT actually increased awareness. Taking the IAT increased awareness. Some committee members did not have positive attitudes about the IAT study. However, so in response to a prompt, at least this was the prompt, taking the IAT exercise is not helpful to the admission process. One committee member wrote, "I don't believe the results of the study." Responding to the prompt, the IAT exercise will discourage the admission, will encourage the admission of underqualified minority candidates. In response, one committee member wrote, "It is more likely to create bias in that it implicitly encourages admission of minority candidates rather than focusing on the content of their character." Can't believe he said that. Implicit racial bias exists at all levels of the healthcare profession. There are serious limitations in the study of its effects on health outcomes, mainly methodological issues. The relation between implicit racial bias and health outcomes is likely complicated, involving mediated and perhaps moderated effects. Training seems to reduce the impact of implicit racial bias, although not eliminating it. And these are references. You have access to these if you need them. You can contact me. Thank you very much, and everybody have a wonderful day.